Hey, this is Kevin with Lawsuit Legal, and today we're going to be discussing everything you need to know about burn injuries. A burn injury is a type of injury to the skin or other bodily tissues that can be caused by heat, cold, electricity, chemicals, friction, or radiation. According to the American Burn Association, there were 486,000 burn injuries that required medical treatment, including 30,000 that required admittance to hospital burn centers. Between 2005 and 2014, there was a survival rate of 96.8% of patients admitted to burn centers. 68% of those were male, 32% of those were female, and the majority of patients, 59% being Caucasian, 20% African American, 14% Hispanic, and 7% other. The types of admission include 43% for fire and flame-related injuries, 34% for scald injuries, 4% were electrical related, 3% related to chemical burns, and the other 7% were miscellaneous type burns. According to the Center of Disease Control, there are around 3,400 burn injury-related deaths that occur each year, with a fire-related death occurring once every 169 minutes. A fire-related injury, on the other hand, occurs more frequently and is estimated to be about one fire-related injury every 30 minutes. The vast majority of burn-related injuries take place at home, while only 8% took place at places of work, 5% were on streets or highways, most likely due to auto accidents, 5% involved recreational activities or sports, and the other 9% were again miscellaneous. In terms of the most frequent types of burn-related injuries, the two most common are from scalding and fire or flames. Contact with hot objects, chemical burns, electrical burns, and other unspecified burns make up the majority of the rest of the burn types, with the rest being random, other non-burn, inhalation burns, and others. The types of injuries that most frequently resulted in burn injuries according to the American Burn Association are non-work-related accidents, which make up 74% of all injuries leading to burns. Work-related injuries made up 14%, and recreational accidents made up about 4%. The remaining burn injuries are from unspecified accidents, suspected self-inflicted burns, suspected assault or abuse, suspected arson, and others. An article from the U.S. National Library of Medicine at the National Institutes of Health states that 42% of all work-related injuries are burns. 40% of all burn deaths are related to workplace fires and explosions, and 20% of all cases of thermal-type burns occurred at the workplace. The Center for Disease Control states that work-related burns were the leading cause of occupational injuries in the United States. About 20 to 30% of all burn-related hospitalizations were due to injuries that were the result from workplace exposures. The most common occupations that resulted in burn-related injuries are manufacturing, electric appliance companies, and restaurants, with the automotive industry slight trailing behind those. Other industries with risk of burn-related injuries include chemical plants, construction companies, and paper mills. When it comes to fatalities by fire-related causes, the two largest causes of death were fire or smoke inhalation and residential fires. Vehicle crash fire deaths caused significantly fewer fire-related deaths than those two, and then other random causes of death. There are three types of burns: first-degree, second-degree, and third-degree burns. First-degree burns are the less serious of burns. First-degree burns usually have symptoms such as redness, minor inflammation, or swelling, pain, and drier peeling skin as the burn heals. Second-degree burns are more serious and include symptoms such as burn-related damage that extends beyond the first top layer of skin, causing the skin to become extremely red and sore and producing blisters. Third-degree burns are the most serious type of burns. In third-degree burn-related injuries, the skin can become charred and brown in color or have a waxy white color. Usually, the skin will appear raised and have a leathery texture, which people would refer to as burnt. In third-degree burns, the damage is so severe that blisters do not even form. There are a long list of complications that can arise from burns. The top 10 complications include pneumonia, urinary tract infections, cellulite, respiratory failure, wound infections, septicemia, renal failure, bacteremia, arrhythmia, and other blood infections. The American Burn Association came up with numbers to go along with the cost of medical care and treatment related to burns. The most common type of medical care and treatment was related to full-thickness burns with skin grafts, which there were 7,532 cases with average hospital costs around $196,000. There were about 2,300 extensive burns or full-thickness burn cases with stays lasting 96-plus hours and involving a skin graft with a hospital cost around $535,000. Extensive burns of full-thickness burn cases with 96-plus hours of hospital stays but without a skin graft cost roughly $210,000. Major extracorporeal membrane oxygenation procedures with burns to the face, mouth, or neck cost almost $1 million at $950,000, and major thumb or joint procedures cost around $170,000. Full-thickness burns with skin grafts cost around $100,000. Skin graft and or removal of skin ulcers or cellulitis with major complications could cost around $95,000, while skin graft and or removal of skin ulcers or cellulitis without major complications cost roughly $87,000. Major shoulder or elbow joint procedures with complications come in at roughly $1,000, and major skin disorders cost about $114,000. There are many types of complications that can arise from burn-related injuries, which unfortunately could be costly. Treatments for disfigurement, scarring, or contracture could cost between $28,000 and $35,000. Psychological complications from a burn-related injury could be anywhere from $16,000 upwards of $75,000. And fragile skin could cost best $38,000 to $107,000. Infections can cost anywhere from $58,000 to $120,000, and delayed wound healing or skin graft failure can range from $37,000 to $110,000. If you or someone you love has suffered burn injuries due to an accident, you should seek out legal help. Insurance companies will do everything they can to limit their liability after an accident. Victims need a skilled lawyer focused on their recovery to ensure they don't settle for less than they may be entitled. Lawsuit Legal helps connect people with legitimate legal claims to top attorneys nationwide who can help, making it simple and easy to acquire award-winning legal assistance when it is needed most.